Any further discussion? All in favor?
Aye.
Any opposed? All right, all that carries on. So now we're on to review of system functioning and activities, starting first with an update.
Yep, so for the county side, the FAPT update, I was just gonna make CPMT aware that we're continuing to see a high number of CHINS cases coming through Region 10. It just continues to, it feels like every week we have new ones coming in. And so there've been a lot of those. And then the other thing was just to make you all aware that we've got a couple of cases where Region 10 is really struggling to find placements, residential placements for a couple of kids. And so, you know, based on what they're able to come up with as far as a placement, that could really potentially have a large impact on CSA. Like if they can't identify a Medicaid provider, and CSA would have to cover the entire cost. It doesn't take much until a lot of that adds up really quickly. So I just wanted you all to be aware that potential is there. And so just wanted to make sure you all were in the loop about that. So I think that's it for the county FAPT update.
And Jennifer, if I could ask, that's not including, I know I have 2 placements, right? So just for the larger group that is likely to be out of state. I don't know if that included my cases I'm working on.
No, right, those are separate.
Right, so I've even alerted my superintendent that looking at some exponential growth, my issue right now is just finding a place, as Jennifer mentioned. But once they're found, the price, yeah, it'll be a big impact. Thanks, Jen.
Yeah, and just to tag on to what Jennifer said, we've seen a few more CHINS parental agreement cases. I think we have more now than we have had the past year and a half. So I'm not sure what's going on. But if Nita or anybody else has any thoughts about that. But
Sure.
We also have a case where we're having a hard time finding a placement. I think some of it has to do with contracting issues with our residential providers. And then you all might remember also last month we mentioned that residentials are starting, there's this trend of them starting to say they're not going to accept Medicaid. So I'm worried this is starting to kind of be a problem for us. It sounds like something we might want to keep our eye on. Benita, I don't know if you have any thoughts about why we're seeing more Region 10 CHINS parental agreement cases now.
So the child world mimics the adult world, and the impact of the pandemic and the other stressors in the city of Charlottesville is really, the chickens will come home to roost, and they are. So overall, the acuity in the children and families we're seeing is much higher than what we're used to in the past.
Well, you think about like teenage suicide rates are up since the pandemic started, and all of that. It makes a lot of sense.
Yeah, so that makes sense. And then, of course, the bed capacity because of COVID and the pandemic and workforce challenges are reduced. And so that's kind of a double whammy, is higher acuity of need, less residential availability in the process of that. So I think this is sort of the beginning when you think of how humans work, pandemic hit and services somewhat decimated, they've changed. And now a year and a half, 2 years later, I think we're starting to see the impact on mental health in both children and adults. So I expect it to actually get worse for a while.
Are there specific requests or needs that could be met through other programs and services that we carry back to our respective agencies.
So are you asking specifically about Region 10? Or,
Just, I mean, it sounds like both youth needing residential placements and services. Is there any sort of call to action on how we might address that in our own, while we're not providing residential services, are there other alternatives that can be support?
well, I will say that you all will hear in different settings of Region 10's workforce challenges. I am happy to say in the child and family world of Region 10, that is not true. We have not had a high vacancy rate. It has stayed at like 2%, which I think speaks to the resiliency of that group of providers. And so while in the adult world, I'm like, yeah, my gosh, we're not providing as much. In the child world, everything's sort of operating at normal capacity from Region 10's perspective of ICC case management, outpatient availability, as well as prevention sort of ramping up for these reasons. We've increased our prevention reach. So I'm not sure how to solve. I'm not sure what the ask would be, because I think what we're experiencing is, yeah, that makes sense. Kids have higher acuity, families have higher needs. And then on that continuum, that residential piece is where we're really struggling with the higher acuity. And I'm not sure how to make that impact, but certainly open to new projects, collaboration, input.
Okay, thanks for the update. Did anybody have any questions or need to review the foster care expenses and FAPT approved expenses from the city and county? Okay. Now we have the CSA coordinator update.
I don't know if we had too much of an update. Hopefully everybody saw, we sent out the public comment to be submitted regarding the proposed family engagement policy. And so we did submit those. And I think the next step is getting with program to look at our current family engagement policy. We talked about last month, we wrote that 10 years ago. So looking at what enhancements we need to make to that. And that would be the next step with that. And then I think, Jennifer, do you want to give an update on the non-mandated work group?
Sure. So, we have the members identified. We're just working right now to come up with a date for us to all actually meet. It's potentially going to look more like it's going to be in the new year before we can make that happen. So just so you all are aware.
All right. Any OCS communications that we need to share to the group?
So there was just the one, and this was just their memo letting us know about they've hired the position for the person that's going to be looking at the low performing CSA programs. And this position is there to help those folks. So supposedly they were going to be reaching out to the CSA programs that are affected by this. We haven't heard anything, so I'm assuming that does not apply to us and wouldn't anticipate that to be the case. So that was the only memo.
And the program subcommittee update is next.
It's not really an update. We were waiting on the language to be approved by you guys. So now that that's approved, I think we will be moving forward with the UR for those mentoring services. think
And
that's
then-
it, Jennifer.
We've had there's been a lot of discussion at program around Chen's cases too in the courts. And so Mark Moore came last or earlier this month and talked a little bit about that and the work groups that are being formed and kind of how to get everyone to the table or try to get people to the table, it sounds like. So we're all on the same page and all working on that. So that was the majority of the meeting, I feel like, earlier this month.
Katie, what was the
Yes.
subject of the work groups? I missed that.
It's Chin Services, right, Krista?
Services.
Yeah, services for Chin's youth, like not just Chin services, but Chin's like supervision, truancy, and
Any
runaway
Chin.
house.
Uh-huh.
Yeah, any Chins.
And are service providers going to be involved in the work group? You were just talking about getting folks at the table. Who are you looking to have at the table?
He's still putting together the work group. I know we're looking at we'll have someone from community attention, we'll have someone from the schools, someone from DSS. More so starting with that for the initial work group. There's probably service providers will eventually be brought in on some kind of sub work groups, maybe. But we're just kind of starting with our most important stakeholders right now, I think.
All right. Thanks for that update. We're getting into other business. And so the first, subcategory of talking about our work plan is the financial reporting. Last month, when we met, we had a very robust presentation from the financial folks at both the city and county. And so I just want to have an open discussion about that presentation, what you thought was good about it, what was working, and then what's not working in those presentations and any sort of wish list items. So anything that we can provide feedback would be great. So we'll start with what did we like about the presentation and what do we like about what data we're seeing on these financial reports.
I'll start from the city and Katie chime in. I'm sorry, you and I haven't checked in about this, but I've been struggling with these for a while now. And I found the presentation very helpful to know what is important to look at, what trends are important to look at, why really looking at the month to month probably isn't that helpful because it's really about when the bills are paid, not when the services are provided. And what we decided to do in the city to help us better be able to hop on things that might be important, at least from the city Department of Social Services, is to look at that month to month for our own expenditures instead of just looking at 1 month at a time and then comparing year to date. We're going to start comparing month to month.
When you say compare month to month, you're talking about like comparing November of this year to November of last year, right? Other feedback about what's helpful on the financials?
It was super helpful for him to go through like the match rates, and even though I was around when that was implemented, but to understand how that was. I still don't feel facile enough to know what should and shouldn't be on there. But I will say from as we look at financials, something about sharing the screen if he's going over it. And I know they come quarterly. like that is a much easier way for me to process information than trying to pull it up on my other screen if I'm in my office, that kind of, there's so much detail in that. So when he comes by, I like find myself flipping, trying to keep up. And so I don't know, I just put it out there, sort of organizing it and sharing screens so that when those guys come quarterly, they can walk us through a little easier.
Yeah, there's a lot of numbers. So you're like, where is that number again? And yeah, so that is really helpful. I agree.
I also thought it was positive just to reinforce, well, one, I love the main sheet, right? The pie charts and the summary, but also to understand its limitations as well, right? Like, Kevin on the county side is like a wizard, like he'll do I see some storms in the forecast. And it's nice to know that it's not just like we're looking for stuff, but it's not there. So to know that the historical piece, so what I've been more comfortable with, even just in the month, is going back to this time last year and the year before with those same reports to know it's not in there. Like when we get the monthly update, that data story isn't there. So that just verified for me. That's right. That's something to do. That may be something in the future, like whether it's an archive or some way for people like to have, like, does everyone have a set of like the last 5 years? Let's say January, last 5 years, even if it's the summary sheet. For me, it was just a confidence builder in using the data to understand the storms and some of the rosier pictures when, there's not many rosier pictures, but when they do happen, then at least I understand the context. So that was my takeaway.
I certainly appreciated the patience that they had with all of us who were like, wait, back up and say this again one more time. And this page says what now? Very patient with their presentation with us and took their time. So I definitely appreciate that openness. So if we were going to provide feedback about what helpful for us moving forward on their quarterly reviews, include having them be prepared to share their screen and move their cursor about to what they're looking at. Whether it's possible to align, last month's figure, the last year's figures at that time. Be helpful to compare years or the historical perspective, and to highlight what Kevin says, the storms are in the forecast, since they do have a close view of that historical perspective, for them to be prepared to share with us things that we need to be paying attention to, concerned about, or excited about. Anything else to add to that list? All right, so it sounds like, other than maybe restructuring a little bit about how those quarterly reports go, do we need to change those quarterly reports or what's on them at all? They can keep doing the quarterly reports as they have been. It's just that they can still do the monthly financial reports as they have been, but just maybe preparing a little bit of a different structure for the presentations quarterly. Awesome. Who's in charge of talking about that with our financial folks? Is that a Nita Misty co-chair thing? Or is that?
I think when we were asking them to come, Jennifer and I kind of prepped them for that. So I'm happy to go back and say, if I'm understanding this correctly, there's not anything necessarily that CPMT wants to see differently with their reports. It's about how they're presented, and in a similar way that you guys did the orientation, where you're pulling it up on the screen so they can follow along with what you're saying. Is that correct?
Mm-hmm. And if possible, to do this time last year, it looked like this.
Okay.
And also if there was any sort of forecasting of, hey, for example, what we talked about in the FAPT update, hey, our residential costs are really up here, or we're actually doing a really good job of the community-based services, or that kind of thing.
So I have a
Or if
Sorry.
there's any way, you know, for that, maybe they have ideas about how to point that out too, that helps us kind of see those trends too.
So the one in that vein, that trend of thinking, one of the things that I've always felt I feel more confident about, it always feels maybe you get more confident just as you're about to, retire or something. But expire, retire. And the question I have is the context of budget. Like, we get updates and we get like the storms coming, but it's never as explicit as, for example, I'd love to do, even if it's an agenda item, I'm projecting, like, I'm going to ask the superintendent to put in his budget $500,000 more for schools. Now, in the past, that's just as an example. I don't know if I'm actually going to do that, but in the past, like, I would talk with Kevin directly, like, is that what you think? But our collective experience and seeing trends, you have been involved more consistently than I have in CPMT in the past. And I'm just wondering about that piece. Like, are we preparing our budgets, even our projections? So taking the data and actually giving it life as we're moving forward. Are we on track? You know what I mean? That piece seems missing for me.
Like where we are with our allocation. I mean, I feel like every year we go over our allocation and we have to ask for at least one supplemental, but so like it's November, are we at 33%? Are we at 60%? That kind of stuff, Kevin?
Yeah. And even looking forward next year, like if I was to, again, it's just an example. I know it's public forum, but it is just an example, like $500,000, given what we talked about, even at the onset, and residential's not taking Medicaid. I mean, that's like $250,000 a kid right?
And I think that if we are looking at that, maybe it facilitates a conversation of where is that money going and what can we do? For example, we now have the special education transition services. If we're seeing that, SPED cases are really driving up our budget, let's have a conversation about how we're using those transition services and making sure, that's happening, or we're getting providers approved. If we need providers approved for that, what can we do to help with that? I agree. I think it helps facilitate some of those bigger conversations about our system and what we can do to help.
But again, right, that would just be the nuance of their presentation, not changing the data. More of our discussion side, now knowing a bit more in depth what all those numbers mean.
Speaking of budget, we have a new person that has joined us, Ryan Davidson from Albemarle County.
How are you?
Welcome to CPMT.
Thank you.
Do we need to pause for a second and do some introductions, Ryan?
Might be a good idea. I know I've spoken with a few of you, but not everyone. So,
well, it's nice to see you again.
Yeah, you too, Misty. But for those I'll start since for those of you who don't know me, I'm Ryan Davidson. I'm the new Deputy Chief of Budget for Albemarle County. I've been here a little over 2 months now. In my previous life, I was on the other side with the city for about 17 years in the budget office, worked with social services and human services there. And I'm going to be working with social services over at the county. So
Welcome. I'm one of the co-chairs for this year, Ryan, and Nita Davis is the other co-chair. So why don't you start by introducing yourself?
Hi, Ryan. I'm Nita Davis. I'm from Region 10 and the Director of Child and Family Services. Welcome.
And now it's just a free-for-all. So introduce yourselves when you're ready.
I'll start. Beth Baptist with the City Schools, Interim Director of Student Services and Achievement, retired, now back doing that again, as well as interim for HR.
And I'll follow suit just not because we do counterpoint. So I'm Beth's colleague on the county side. I'm Kevin Kurse, the Executive Director of Special Ed and Student Services for the county schools.
And I'm Martha Carroll from Juvenile Court Service Unit, and I'm one of those folks who can help make a quorum for both jurisdictions. So thanks for joining us.
Ryan, I'm here representing the City Department of Social Services.
I'm Krista Gallio. I'm with Court Services also, but I'm here for CPMT as the Programs Subcommittee rep.
I'm Mary Stebbins, Deputy Director for Albemarle Social Services.
Hi, I'm Jennifer Wells. I'm the CSA Coordinator for Albemarle County.
I'm Erin Callis. I'm a nurse and I represent the Charlottesville Albemarle Health Department, and I, like Martha, can represent both the city and the county. I have one special power. Welcome, Ryan.
thank you.
I am Katie Ralston. I'm the CSA coordinator for the city.
I'm Lisa Jordan. I'm the one that's going to send you all the annoying emails and documents. Lots of them.
All right. Thanks, everyone.
We're in the vein of our work plan. And I'm reminded about one of our goals as far as onboarding new members to CPMT. I'm not sure that we've fully flushed out that process, but welcome, Ryan, and for details on how you're appropriately onboarded to CPMT. Anything else about the financial reporting? I was just going to add to the wish list item, and I think I mentioned it last month as well, the wish list item about looking at where the city is and where the county is side by side is also kind of a unique perspective, because I think sometimes we're surprised at how different the numbers are. Sometimes we're not, but it's just always good to say, I wonder why that is in the county and not the case in the city, or vice versa. And so I think that would be helpful to see as far as a wish list item. If we can pass that feedback along, that'd be. All right. Next agenda item is the format of the template. Jennifer and Katie have an update on how that's going.
So obviously we're still working on that. There's pieces that still need to be worked on, like the whole orientation piece for new CPMT members. Katie and I are going to be getting together to work out the whole acronyms that I think Misty started out with the list. And so we just need to work on that. And then I was going to check in with Nita to see if she was able to share the template that Region 10 uses, because she had mentioned that they sort of have a way of tracking historically, like what they've done. So I was just going to check to see if we could borrow it. Katie and I have definitely struggled to find a format that's going to work well for what we need. So I was going to check in with Nita about that, if she could share.
Yeah, it won't be very impressive. It really is just using Excel to.
I think we want something simple.
Okay, I'll send you we don't do it anymore because we lost that thread. So it'll be outdated, but I can send you how we did it. And it literally is just using an Excel sheet. Okay, absolutely.
Thank you.
Thank you.
I think the goal, if I'm remembering correctly, was to get it to a place where it's easier to manipulate and edit and to add updates when we review it. Like, what do we do this quarter? We can add like the specific action items, because at the end of the year or at the audit, they ask about that, correct?
Yeah, I think it would be
And
nice
even
if
going
somebody
through all the
can,
minutes,
if somebody can
having
look
it
at
all.
it and have a good idea of what we're working on and what we've done, basically, is the goal.
And I also think it's good for us to hold ourselves accountable and also to celebrate our accomplishments when they happen. To be able to look at that, oh yeah, we did do quite a bit this year. So it's nice to find a format where that's in a central place. It's great. Thank you for sharing, Nita.
Yeah, I think Robert did that really well. So I will share that process as well that we did.
So the next part of the work plan that we were going to spend some time discussing is the diversity, equity, inclusion goal that we have, although it's not currently fully worded that way. Currently, the way that it's worded in our work plan is that our goal 5 is to ensure diversity within the CSA system. Our desired outcome being our CSA system is diverse at all levels, and the indicators being that the members on CPMT, program, and FAPT are representative of the community. And so I think part of the action items that we agreed to when we created that goal was, 1, to encourage CPMT members to take an intentional look at diversity within their agency, and develop the second action step would be to develop opportunities within program and FAP to incorporate diversity to include targeted recruitment for vacancies and agency assignments of members. So Nita and I both shared 2 examples of sort of assessments or continuums as folks are looking at diversity, equity, inclusion, specifically anti-racism in their organizations. And so there's 2 different frameworks that we shared. There's likely others that maybe members on this group are aware of as well, but just wanted to start here as a place to discuss, and just wanted to open it up with a broad general question about what are some of the initial thoughts that you had as you were taking a look at those models.
Thank you for sending those out. I thought they were great, and I know they're being used in other groups in the community, but I think it would be helpful if we had some sort of plan to review policies that we develop for racial equity, diversity, inclusion issues, language, unintended consequence, things like that. And I'm not sure of a resource for that. I'm looking for one for that for our own department, actually. So if anyone has any ideas on that, I'd love to hear them.
That might be something we could reach out to Irtifa about. And Oi, she probably has some resources that we could tap into and look at for that.
Are you saying looking at like the CSA manual and the CSA policy to review it for that kind of language?
Yeah, contracts, our UR documents, anything that we have discretion over and then can modify. I think we need to be aware of what we don't know.
Other general thoughts about the 2 assessment?
You know, I've seen these assessments, but even when I review in both of them, like It remarkably rings true. As I read through sort of this progressive steps for an agency. And it can feel very overwhelming because it really is changing a way of operating and adjusting a shared power that is much easier to say than to do. You know, I feel like Region 10's been working super hard on this. And so while sometimes I'm like, yeah, but just realizing as I read it through and where we need to be and the kind of time and continued commitment of intentionally attacking things that for a lot of us is just a way work ran. Like I didn't even know that it was shutting down voices and, you know, I didn't even know. And so thinking through that, it is large and huge and a process. So yeah, those were my takeaways.
When you looked at the assessments, were you thinking about your own organizations or were you thinking about CPMT?
It's
That's
hard
for
not
the
to do
collective,
both.
not just to you needed.
Yeah.
Just because you're the last
I
person.
get
but It
that.
wasn't to you. It was just
Yeah.
for anyone to comment. I'm just interested as you're looking at like the objectives or how to go from one end to the other. Were you thinking about how this applies to your own organization? And did anybody look at it from the lens of CPMT?
So I think I was looking at it more from the lens of my own agency and didn't necessarily move to CPMT in a broad brush way, I would say, because I feel like there are some things that we've been doing. There's a lot we need to continue to do, but I really probably didn't focus enough on the CPMT aspect.
I've only had the experience of looking at it from my own organization's lens. That's where the charge is. That's where the day-to-day, where we spend most of our time and where we actually have, to Sue's point, those things that we do have control over. But when I think about CPMT, it was definitely a different exercise. Thinking about CPMT and how we function as a group and our representation and membership and how we make decisions and so it was interesting to think of it as a member of CPMT, as a member of this group, as an entity versus there's also a different level of knowledge and awareness of what's going on in your own agency. And so there's just there's things about CPMT that I just don't know with regards to this and where everybody's at. That's sort of the challenge that I had on my mind is like, this would be really challenging to do as a group of us because it hasn't historically provided that kind of intimacy or knowledge about what every individual organization is doing.
I agree, Miss. It was really hard when I thought through CPMT and I really struggled with that, would benefit from conversations about how does this apply to CPMT I will own that for me, what kept coming up was one just example where I think we've tried to make improvements, but it's on parent representatives. Like at FAPT program and CPMT, I think it's an opportunity to get people with lived experience and diverse backgrounds to have a voice. And I remember the struggles around, do we pay them? Do we not? 20's too much, 15's too little, And I think revisiting that in a way that brings that voice back and realizing, yeah, they don't show up because they're people with lived experience. Like, I don't see how we can't reimburse them for their time and effort if we want that input and representation. So that just comes up as an obvious one, but all other things, I really struggled to think through, like, how is this in the CSA process?
One of the things that I think is helpful is a parallel process, looking at your organization with this model, but also looking at CPMT at this model. I don't think it's an either or, but when we think about those memberships that you were saying, Nita, and we think about our organizations and, the policy that states who has to be on CPMT or program, in fact, and what qualifies someone to be at the table. So when I looked at the continuum, one of the things that it says in a club institution, it says tolerant of a limited number of token people of color and members from other social identity groups allowed in with proper perspective and credentials. And it just that sort of struck me. It maybe not be exactly the same, but it did sort of struck me as like what qualifies or the proper credentials to have someone be an influencer in CPMT, FAPT, or program. And made me question that a little bit. And going through, a policy like Sue had suggested may highlight some things that we can change.
And Missy, maybe that's part of the process, because looking at it, I was looking at it as from CPM to a CPMT, just as a pragmatic approach. It's like, what could we do immediately, right? Versus taking time to self-assess, because there's that whole time element too. Well, we're working on our organization. We'll get back to CPMT and lose a potential opportunity, but it's always that balance, right? It's okay, someone to speak on behalf of a $3 million investment on the county school side. It's like, all right, and there are, and looking at it in a hard way, right? Like, yeah, there are requirements and roles and liability that come with this level, that even if we don't radically change, at least we radically look at it and state, here's what we have, here's what we can change, here's how we can add voice, but confirm liability, right? Like all those things that we've talked, like that we've taken for granted. It's, let's slow it down enough to self-assess. Why is it? And start to break it apart and put it back together. So I was looking at it as CPMT and somewhat invigorated by it, but also a little frightened too, right? Because of that liability piece, we have a huge community responsibility, and want to balance that appropriately, right? With voice and certainly all the other aspects of equity. But I think it'll be a painstaking process, but one I think we could do as CPMT, even if it was in pieces.
There's value in starting where we are with what, we do have and what we can do now or more immediately. I think it might encourage us a little bit and help us take some small steps.
We're looking at the goal, the intention behind the goal that we created around taking a closer look at this as far as CPMT goes. What's the end game? This is not a rhetorical question.
Is that something that we need? I don't know what the end game is. It could be impacting the disproportionate number of kids of color that are entering into the system. That could be one. Or another goal could be moving towards representation that's diverse at all levels like that. I mean, I don't know, and open for what's. But if you're looking for the right answer, I don't have that.
I certainly don't have the right answer either. It's just an opportunity to discuss how we might rethink the goal in a broader sense. I think the liability, I think of it as we have a responsibility to the community and the kids that we serve. And so there's liability in that. And if we don't do this kind of work, we're not doing our best work. If we're not doing the anti-racist work, if we're not working to become more diverse, that's the kind of liability that makes me feel a little uncomfortable when we think about where we are, the overwhelming feeling of like where we are now. Fair. We also have a responsibility to the kids that we serve. And if there's a majority of kids that we're serving of kids of color, then we have a responsibility to them to become more representative. And if we're not representative, then what's our responsibility then? Until those changes are made or we think through how we might get some authentic engagement from additional staff of color or people of color, what's our responsibility then? One of the things that I had thought about is like our responsibility is to continue to have these conversations so that we can become more aware for the white folks in the group that we're doing our best. Without having that perspective, we're doing our due diligence. So thinking about how we might use this tool moving forward, how we might rework our goal a little bit. Does anybody have any suggestions on either of those two things?
I mean, Misty, I guess if it's conversation and structure, right, it would be, there has to be a really nice self-assessment tool. Even if we start with what we know, and that is our organization, like, okay, how did I get here, right? And was that the best choice? And we start to reflect on that from an organization like Albemarle County Schools is bringing through our self-assessment. Here's what we're doing. Like, and so I think there's some real credibility to starting with our home base and then talking about how that influences. And then collectively, once we've self-assessed how we as an organization are bringing forward hopefully our best, then then collectively, what can we do pushing back? But it would seem like it would start with some type of self-assessment tool, even if it was just questioning and having something as part of the agenda to tackle. Whether it's an agency highlight or a collective, hey, here are our responses, might be something tangible that would start things moving. That would be mine. And I certainly don't mind reaching out to I have my equity specialists here in the schools have been incredibly active to see, is there a parallel tool that would go with the continuum frame that was presented? I don't mind taking a look, but not wanting to step on toes or jump ahead if someone has a self-assessment tool. But that would be my suggestion as a start.
I sort of struggle with, like, I like that, what you just said, Kevin, and see that a lot of benefit could happen. And then where I start struggling is, oh my gosh, like we could do that forever with our agencies, because I think our agencies are all on a different place on this journey to dismantle racism structurally. And so the pushback self says, but then we'll never get to the CSA process and and that maybe there's some low-hanging fruit there that moves CSA system forward. I mean, I can be talked into either way, but that's the conflict of and the blank look when we say, where do we start?
I didn't anticipate this conversation being easy.
Might we do a little of both? Like save space for CSA, to, like take Kevin up on him, consulting with the specialists at the school because they have so many resources. And in our discussions, save a space for, okay, like, this process of representation on committees and gleaning feedback, all those things is a possibility.
What if for next meeting, we just asked folks to utilize either the tools that were sent ahead of time to do an assessment, or if folks wanted to share additional resources from ones that they've used before or other recommendations, but to come prepared at the next meeting to say, here's where I think my agency is at. Here are some things that we're doing. Here are the things that are on our goals list. Here's what we're thinking about right now.
And do we need somebody like Kevin referenced that's in the school system to look at this outside of ourselves? To evaluate, to see, to give a different perspective? I don't know, just a thought.
I think, yes, self-assessment is one thing, but having a objective assessor is another thing. But I just and I don't think that that's necessarily off the table. I was just thinking, like, from a starting point, getting to know each other and what we're doing, because we're in this together, and there may be some opportunities or learning that you all have had that we haven't had, that we could benefit from one another in this space. And just starting there, and then, as we sort of meet monthly and we sort of check in on this goal, perhaps there's some additional learning that we share or resource that we share, or maybe it's time to open up the CSA policy manual and we have a few folks that are willing to do a subcommittee on that, like as we start to do that. But I think maybe starting from let's get to know each other a little bit. We're going to be doing this.
But to Erin's point, and Misty, I think like it even sounds like as we start that, you know, we've done retreats and right, like work sessions outside of this meeting, that could be like a facilitated, much like, what did we do? Like strategic planning, right? We had like a facilitator come in, something to that effect with this as the focus. Certainly if we start to really get some traction, getting to know each other, that seems like it would be a real hefty lift, but give some oomph to we need some time aside from the business to digest and dive in. And I would see Erin's suggestion of, yeah, we could use a facilitator that with expertise in that to challenge us all respectively and then collectively. So I would throw that out, that I think there will be. I could imagine just even talking out loud here, a time and a place for that down the road. Yeah.
When I was introduced to the Uprooting Racism tool, they had a outside external person to actually explain the tool, what this means, why it's like this. Dr. Selena Kozart, maybe you guys have had time with her before in your circles, but she's fantastic. And she, we met for six weeks, every other week or every month, to go through individual action plans. So it was really great because it was a mixed group of folks outside of the city. There was folks from the Haven and a granting agency, a restaurateur. It was just a different kind of organization, and we were all very like willing to say, this is where we've kind of fallen short. This is where we're getting some traction. Here's one thing that I promise I'm going to do before the next time we see each other. That kind of thing. And we had an external facilitator to help us work through that Uprooting Racism tool. So we do have a local resource that we could bring in to do that either at our next retreat or outside of retreat time. But I agree with the benefit of doing it outside of normal business as well. Intentional set aside time for that. Other suggestions from the group about how we might pick this back up next month? Okay. So I'm not sure if we came to the decision on what to do next month, but there was a suggestion to use these tools or others to give sort of an update to folks on what we're currently doing in this diversity, equity, and inclusion realm. Okay, let's try that then, unless there's alternatives. Okay. All right. We are getting close to the end of the agenda. So we're here at this place where agency members can give an update on what's new in your world.
I don't have anything that's really new in Charlottesville schools, but I do have a 6-week-old grandson who I took a day today to help his mother go to the doctor. And I just sent my son and my daughter-in-law off. I said, just go out. So they have just left me with him. And right this minute, he's not very happy, but that's what's new in my personal world.
Lovely.
You know, there's
Let's
nothing
face
new
it,
in
let
my
me-
world at all. Just boring, quiet. So, you know, we just rolled out 5 to 11-year-olds, which, you know, we're trying to be judicious in how we roll that out. And use diversity, equity, and inclusion to make sure all have access to this vaccine for 5 to 11-year-olds. We've had a good success initially in this last week for people coming out to get the vaccines. That's probably my biggest update to pass along, and then trying to, bring back again all of our other services to a more robust piece, similar to what they were before the pandemic. Be so happy when I don't have to say those words anymore. But anyway, that's from my world.
Thanks, Erin.
Well, Krista touched on the work group out of the Georgetown project around CHINs. And so I think that's the focus for us, really, is organizing those groups and trying to connect with community partners to join in that. And we're making some progress with that in the work group related to technical violations. And so we're looking to get that work off the ground and include people and broaden the folks who are involved. And we're going to do some family engagement training for our whole district and for some community partners here. We're going to be on the receiving end of that starting in mid-January. So we're really looking forward to that initiative too, to support the work. I think we have a lot to learn in that area.
Other updates? Oops, I went to the wrong button. I think the last thing that we wanted to talk about is thinking about our meeting time. I think last couple months that we've met, we've ended up running over that 5 o'clock time and sort of felt rushed through the last parts of our agenda to get through them. And so one of the suggestions for the group to consider is to start the meeting at 3, so that we hope to keep to a 90-minute meeting, but in the event that we have something come up and it runs over, we're not feeling rushed to be backed up into the 5 o'clock. I've got to go somewhere. Do folks want to start at 3 with the goal of ending at 4:30, but having that little buffer may be helpful? I got 2 thumbs up and a strong head nod from Katie Ralston. I got a thumbs up from Aaron. Any opposed?
I don't know if I get it both, but
any problems that folks might have with starting at 3 versus 3:30?
Misty, it's a short-term thing, but I would go with the will of the group, but just understanding with all the shortages, I'm filling in some for staff in some respects, and I might be late to start, but I'm looking on it for a solution. But so just being very forward and just saying, long-term, absolutely. Short-term, it just might be I'm a little late, but it really is kid-based, not my own. It's student-based, and it's due to this lack of staff, available staffing. So, but all for the concept and the long-term solution.
So when you come late, and since we're not in person, we can't require you to bring cookies or candies or things. Is it, what can you offer us in lieu as a exit pass or a excuse slip?
I will bring ideas to the next meeting.
That's fine.
His knowledge is worth him being a few minutes late if he has to be.
Oh, that's so kind.
That's because she's holding a baby. She doesn't know what she's thinking.
She's feeling extra generous and kind right now.
I think, Lisa, you're gonna have to send us 27 reminders to make sure we know to come at 3, because we're so used to coming at 3:30.
Exactly 27.
Exactly 27.
And I do have a quarterly meeting that bumps up to 3 o'clock. Right now, virtual world, it shouldn't be a problem. I might be a few minutes late if I have to run down the hall to the bathroom or something. But once either of those meetings, this meeting or that one is in person, it might be a struggle because I'll have to travel. So, but it's quarterly. My
It's
first.
3:15. It's
I have the
3:15.
I
same
mean, so 3 is fine. I just know I might be 15 minutes late if we're ever back in person again. So once every 3 meetings. But anyway, I'm not meaning to say no to the 3. I'm just letting you know that I have a potential conflict eventually.
What were you going to say, Krista?
I just have the same issue as Mary. I have a quarterly meeting that goes until 3. So it would just be a couple minutes late, or depending on if we're virtual or in person.
I feel like maybe we should just do 3:15. Let's give this a shot. Like I said, we're still going to try to hold to 90 minutes, but it's just nice to have that little buffer time. Okay.
Yeah, I would say just for me, because 3 o'clock, 3:30, 3:15 is not going to be a huge difference. The issue is that this is Board of Supervisors Day, and so I have to attend those quite frequently. And the work sessions typically end right around 3 o'clock. There's where they're supposed to end. So if they tend to go late, like it did today, then I'll end up being late for these. But other than changing the day, there's no way to avoid that. So just wanted to let you know.
For new members to CPMT, when you're late, we require interpretive dance.
I was gonna say song or dance was what I was expecting to come out, but
we all had to do it when we were new. So it's just your turn.
I was gonna say that, but I don't want to torture people on my first days here. So I believe singing and cats being neutered kind of come along in the same sentence a lot of time when people are talking to me. So just as a warning.
Let's try 3:15. See how it goes.
And just to tag on to that, I do think next month we're going to have to start talking about meeting in person again, because I do think we're going to be required to do that at some point soon.
What do we need to do as far as getting like space reserved and fun things like that?
So as far as I've heard on the county side, the county meetings are remaining virtual. I haven't heard anything any different. And so the meeting space that we had been using was the county's meeting space. And so if the county is remaining that way and the city does not, I think the city would, 1, have to find a space, and 2, if the county remains virtual, it would have to somehow have a virtual component, because I don't think we would be able to come in person.
City space can accommodate that, but the city doesn't have a reopening plan until mid-January.
Not
And
that once the city and county were open again, we had to start meeting in person. But
We were open, but we don't have to meet in person. Then we have a what's it called?
It's that thing that gets read at the beginning about the continuity of government. Like, that's the whole reason we have to say all of that stuff, is because we're continuing to do it that way. And so it's not under the state emergency order that went out of effect. This is the county's doing. And so until that changes, I know we remain virtual with these meetings.
until what changes, Jennifer?
Until the county, it's the county
Oh.
ordinance that's causing us to have the meetings the way we are now.
Yeah.
And there's no end date on that.
Not that I know of.
Okay.
Not as of yet.
I think they re-up it every once in a while. Like I'm trying to remember. I'm trying to find what Susan
Deadline
said.
keeps
I
getting
asked her.
pushed.
I think the last I heard, and maybe Sue knows differently, but the last I heard, the city's was mid-January.
Yeah, but the issue from the city's ordinance, my understanding is that once we're open to the public meetings have to be available to the public, and the city just doesn't have the capacity right now to support a hybrid participation. So if the county's willing to continue to host electronically, I don't see why we couldn't ask that the city CPMT remain electronic, but I'm happy to follow up on that.
Yeah, and I'm happy to talk with Brian about it too, Sue. Because that's how we've, basically what happens is when Lisa sends me the public link for this meeting and I forward it to Brian Wheeler and he posts it out for the public. So if we're allowed to keep doing it that way, then beautiful.
And Katie, if you can let me know what's decided, because like you guys post the one for program, so I know that that would affect program as well.
And so Katie, I think that question would go to Lachine since Brian's last day is Friday.
I did not know that or realize that.
And it's also possible that City Space can host a hybrid meeting. But thanks for tracking down that additional information. We'll bring that back to the next meeting. All right. Thanks everybody for your participation, engagement, pleasantness. Look forward to next month. Eat lots of turkey or tofurkey or turduncan or yams, sweet potatoes, stuffing. You know, those things that come up in a couple. Oh, next week. Is that next week? Get excited. I hope it's a very thankful time for all of you. Appreciate it. Y'all have a wonderful evening.
Bye.
Bye.